it says preparing to stream live, so it should be going in a minute. Okay, so I think we're live on Facebook now. So I will just admit those people who are in the waiting room. Hello, welcome to those who've joined via Zoom. If you could stay muted, that would be really great. And I'm just going to share my screen to get my presentation slides up. Hopefully you can see these slides now. Hello, welcome to this Sexual Health Week webinar hosted by Healthwatch Bury. My name is Catherine and I'm an engagement officer at Healthwatch Bury. Today we're joined by Alison and Penny from the Bury Sexual Health Service and also Lauren from the LGBT Foundation. My colleague Anne-Marie is here again moderating comments. So I just want to go through our guidelines for commenting and interacting with us today. You can comment via Facebook if you're viewing there. If you've joined us via Zoom, you can comment in the chat box. So our guidelines are be accepting, respect boundaries, don't be rude to our guest speakers. Don't flood the chat with the same comment. We will get to your question. Don't promote anything. This is not a space for selling stuff. And obviously keep your comments clean. So today I'm just going to do a brief introduction about Healthwatch Bury, who we are and what we do. And then Alison and Penny are going to be giving a presentation about the Bury Sexual Health Service. And then Lauren is going to be doing a presentation about LGBT sexual health. And at the end, there is a Q&A section. So if you have any questions for our guest speakers, please comment below if you're viewing on Facebook or pop them in the chat if you have joined us via Zoom. And I will be uploading this video to YouTube. So if you can't stay for the full session or if you've missed the first bit of the session, you can catch up later on YouTube and that video will have full captions. So who are we, Healthwatch Bury? Healthwatch is a social health and social care champion. We collect views from people who use health and social care services with the view to making them better for people who use them. We also offer information and signposting to local services. And if you want to find out more about what we do, you can visit our website, which is healthwatchbury.co.uk. You can also phone us on 0161 253 6300 or email us at info@healthwatchbury.co.uk. We have a Twitter, a Facebook and a YouTube. So if you're watching this video on Facebook today, please give our page a like. And if you're watching on YouTube, please subscribe to our channel. And I have put our contact details in the description of this video on Facebook. Just so if you want to contact us, the information is there for you. So now I'm going to hand you over to our first guest speakers, which is Alison and Penny. So I'll just let them get their presentation loaded up.
Hi there. Ali, I think you're on mute, my lovely.
Sorry. So my name is Alison, and I work for the outreach team in sexual health services in Bury. So myself and Penny just wanted to give you an overview of our service, talk a little bit about what the aims of our service are, and what we offer in the community for young people and vulnerable adults and everyone really. We offer group services and one-to-ones, and we also offer a range of clinics. Our clinic is based at Bury Townside Primary Care Centre in the centre of Bury. We are part of the adult service. So we've got an adult service and then a young persons and vulnerable people's outreach team. So although we're sort of two separate services, we're all very integrated as well. You can access any clinic, but we do have protected clinics for young people under 19. The clinics are also available in Rochdale and Oldham, and if anybody needed information about when they were, they can access the Sexual Health Hub online to find out the times and openings. We offer a range of different things, and Penny's going to tell you about them.
Hi, I'm Penny. I am the outreach nurse that is based there in Bury. So we just thought we'd start by giving you an overview of the provisions that sexual health provision as it stands in Bury at the moment. So we currently offer a range of clinics which are accessible for all ages, and the way that you access these clinics is via the phone and book an appointment, or online by booking it. There's no drop-in clinics running at the moment, and this is due to COVID. And whether that'll change again and we'll go back to drop-ins, we're not sure, but just to sort of remind everybody that our service is an appointment-only service at the moment. As Alison sort of said a few minutes ago, we run dedicated young persons clinics twice weekly in Bury, and they are on a Monday and a Wednesday afternoon between 1 and 4. And just to sort of point out that on a Wednesday, it's a protected service. So that means that there's no other clinics running at this time. So that if you're a young person, you're not going to bump into any adults that you know, sort of your neighbour or your mum and dad's sort of friends. And we find that quite important for our young people. We run daily clinics throughout the week, and every third Saturday we run a clinic on a Saturday morning. And in those clinics we provide a range of contraception, and we have specially trained nurses in those clinics that are able to fit coils and implants. At Bury, we have a dedicated outreach service, as Ali sort of began to sort of explain, within which we offer a young person's education service and a clinical service for vulnerable 13 to 19-year-olds. There is also a young person's clinic that runs in Middleton, and that's in the health centre within the shopping centre in Middleton that young people in Bury can access, and adults, and we run a young person's dedicated clinic in Rochdale as well. Within the clinics at Bury, we provide HIV care from diagnosis through to ongoing treatment, and we also provide PrEP and PEP, which are pre and post exposure treatments for HIV. We provide outreach sessions and contribution and contraception in the community for vulnerable people, and we provide sexual health, sexual infection screening, both symptomatic and asymptomatic. and we do the treatment of STIs in all our clinics. And for the 16s and above, you can order an online free postal kit for asymptomatic. So if you've no symptoms at all, you just want a routine checkup, you can order a kit online, and these arrive very discreetly packaged in plain packaging to your door. And if you're over 16 as well, you can also order free condoms online. Right, Ali, over to you.
So the sexual health team, the outreach team, have some very specific aims. We want to try and reduce risky behaviour amongst vulnerable people. We want to equip young people to identify and manage their safe boundaries within their relationships and have the confidence to negotiate those and speak out in their relationships. We want them to increase their awareness of what constitutes a respectful or abusive relationship, and also help with leaving those relationships if needed. And we also aim to increase understanding amongst vulnerable young people about their rights within sexual relationships. We encourage and empower young people to access contraceptive services, take responsibility for and prioritise their sexual health. So all our education that we do with young people is hopefully increasing their self-worth, their self-esteem and confidence, and helping them to prioritise their sexual health and know that they can come to services and access friendly advice and support. We offer safe and confidential STI screening and contraception outside of a clinical setting. So Penny's going to tell you a little bit more about our outreach nurse clinic in a bag, which means that we're flexible to young people and vulnerable people's needs, and we can give them their care, whether that's in a clinical setting or if they feel more comfortable in a home environment. We want to increase awareness as well of workers, individuals and organisations that young and vulnerable people can approach locally for help.
So as I explained earlier, I am the outreach nurse for Bury rather, and in Rochdale, the outreach nurse is called Paula, and she's also the outreach manager. And in Oldham, we have a nurse called Helen Tinker, and come, hopefully, fingers crossed, November this year, we'll have a fourth nurse joining us who will work across Bury and Rochdale. We are all sexual health and contraception trained nurses, and we're all highly experienced in working with young people and vulnerable adults. And we're very experienced at balancing confidentiality and those needs that a patient has around confidentiality with complex safeguarding needs of those clients. As Ali sort of referred to, we provide a clinic in a bag service. Sometimes it's a fairly large bag, and we're able to therefore travel to vulnerable patients. So for whatever reason, so maybe it's a little bit intimidating coming into a clinical environment, it's too stressful, sort of traveling and organising yourself to get to us, we can sort of go out and visit patients as long as the environment's safe, in an environment that is more comfortable for them. We also provide drop-in sessions within children's homes, schools, youth centres, mother and baby units, to mention just a few. We are, as outreach nurses, we are particularly focused on vulnerable individuals who historically finds accessing sexual health services difficult. And what we hope to do is provide a link between them and the main sort of sexual health services in Bury. We provide hopefully a young people, a friendly young person-centred approach to our care, and we try and foster empowerment and better future access to the service. So when a young person interacts with us and uses our service, we hope they leave empowered and feeling confident in our service that they can come back and use us again. We also support vulnerable adults through homeless projects in Bury, such as the ABAM, which is the Bed Every Night project, and the local drug and alcohol services. And the idea there is to help build links in there. So these individuals are often referred into our service. We make contact with them first. We introduce ourselves so they feel that they know us, and they've got sort of a voice that they know. We explain what's going to happen, and then we arrange times that are appropriate to that service user, so that they feel comfortable sort of accessing our service. And we also have, all of us have a broad understanding of patients with additional needs. And because of that, we're very much able to tailor our services to these individuals. And that means sort of accessing, if they have to come into the clinic, at times when it's maybe quieter, when there are less clinics running, so it's not over intimidating for these sort of individuals. And we can also offer extended appointment times so that people don't feel rushed in their appointment times and feel that they've got space to talk to us. Right, Ali, I think it's over to you. Oh no, it's not. When we looked at doing our presentation, we felt that we wanted to talk about the provisions in Bury, but we couldn't not just give a tiny overview of STIs. So just so you're aware that 70% of people with sexually transmitted infections don't have any symptoms at all, or they may have a transient symptom, so a bit of a niggle for a couple of days that pass, and by that time you think, oh, I'm not going to go and get any screening done, it's disappeared. We recommend that sexually active people should be fully screened for all sexually transmitted infections after each episode of unprotected sex, and especially when that occurs with a new partner. And this can be done not only at our sexual health clinics, but you can go to your GP for sexual health screening. And you can also, as we sort of talked about earlier, order an online postal kit. And all people that attend our clinics are also offered blood tests for HIV, syphilis, Hep B, depending on their risks. And this can also be done by a finger prick test. So for those that are needle phobic and worried about having sort of needles and blood taken from your arm, we can offer that in maybe a less traumatic way for them. Right, Ali.
So I'm part of the young person's outreach team, and my role is education and one-to-one non-clinical support. So my role has been to go into schools and other settings to offer education to young people around sexual health and keeping themselves safe. Just mainly because in schools, teachers were finding it difficult to talk about sex and relationships and then talk about geography afterwards. It was all just a bit awkward. So our team offer a targeted group work, non-clinical advice and support, and one-to-one education sessions throughout Bury and Rochdale. We're not limited to, but the 6 main topics that we do talk about with young people within those sessions are sexual health and well-being, contraception and STIs, risky sexualized behavior. We also talk about sort of demystifying pornography and the problems related to watching pornography as a young person, relationships and consent, and almost all of our sessions relate back to and talk about sex and the law, safe internet use and phone use, especially with sort of social media being on the increase. There's so many different platforms now. And so it's really important that we talk to young people a lot about indecent image sharing and making sure that they understand the consequences of that, both for themselves and within sort of the law as well. So the service provides bespoke programs of one-to-one sessions between a young person and a member of our sexual health outreach team. Usually the sessions last for 6 sessions, sort of once a week for about 30 minutes to an hour. We can tailor those again to each specific person and individual need. So if somebody only needs 3 sessions, that's fine. We can just do 3 sessions. If somebody needed 8 sessions, then we could look at that as well. We take referrals as well as self-referrals from other services such as schools, social workers, youth workers, drug and alcohol workers, and at the moment we're seeing an increase of parental referrals as well. Parents wanting support for their children around relationships and becoming sexually active. Unfortunately, like most services, we operate a waiting list system, but if you do make a referral into us, our administrator, Stacey, will assess the case, and anything requiring sort of urgent intervention will definitely be prioritised and pushed to the top of the list sometimes. A worker tends to get in contact with the young person directly. We don't tend to contact parents or the referrer themselves unless it's been stated on the referral that needs to happen. But most of the time we contact the young person directly so that they've got a link with us. And also, we are a totally confidential service, but we work to strict safeguarding guidelines and work in close partnership with other specialist services. Most of all, we try and provide a quick, easy, confidential access to one-to-one support for young people and ensure that they are seen within a timely manner. So, if you want to make a referral, referrals are welcome to our service for sexual health, relationships, boundaries, someone who might be in an unhealthy relationship or starting relationships, consent, risky sexualized behavior, inappropriate use of photography, including sending, requesting and sharing, age-appropriate relationships, sexually harmful behavior. We can support around contraception and pregnancy and termination of pregnancy support as well. If you are unsure about anything, you can ring up and ask Stacey whether the referral is suitable to be made.
So next, just a quick chat about our Condom, our C-card scheme, which is a confidential service that provides access to free condoms. So the C-card works at any participating agency in our area. For example, colleges, schools that sign up to the service, youth services, places like Early Break, sexual health clinics, or any drop-in service that we run. And in there we offer a range and size of condoms that are some that are latex free, flavoured and internal condoms and lubricant. So the scheme aims to allow young people access to condoms for free in places that are easily accessible to them. It involves young people aged between 13 and 25 having an initial consultation and being registered, and then they receive a C card with a unique number on it. Now, we are aware that even as sort of adults, never mind young people, we're good at losing things. So, sort of if you sign up for a C card and you lose it, don't worry, we have things in place to sort of rectify that. The C card consultation allows the young person a chance to talk about their relationship and sexuality in a safe, non-judgmental and confidential space with a trained advisor. And part of our role as an outreach team is that we have a specific C card person who's responsible for the C card scheme, and she goes out to these outlets and she trains the people up on how to sort of assess young people safely for the C card. And the C card aims to promote an open and honest culture where condom use is simply the norm, and it engages young people who wouldn't normally access mainstream sexual health services.
So another part of our role is that we can provide stalls at health promotion events. So we often do Freshers Week at all the colleges, and we also do stalls at Pride as well. On the day, we can provide C-card sign-ups, chlamydia and gonorrhea screening, advice and information on the spot. If a nurse is free, then she can give information on contraceptive types and possibly do an assessment and booking for contraception. We give out promotional materials and key rings, signposts to the clinics, we refer into other services, and we can also offer pregnancy testing as well.
So just a brief summary then of what's available. So as a service, it is our priority to assess and commence women on a method of contraception that is most suitable for them to prevent unwanted pregnancy without incurring a cost. And once we've got somebody settled on contraception and it's suitable for them, and it's a method that requires repeat contraception, so for example the patch or the pill, then that repeat contraception can be provided from the GP, and we liaise with the GP to ensure that they have the information should you want it sharing with them about the method that you've chosen. We offer and fit LARCs, which are long-acting reversible methods of contraception for contraception purposes, and that's the ear implants and your IUDs and IUSs, which are your coils. And we also offer the contraception injection. As I've previously said, HIV care. We also offer the HPV vaccine for men who have sex with men, and the age there, a lot of our young men now are being vaccinated within the school system, but there is a number that fall out of that vaccination programme that can be vaccinated within our service. Hep B vaccinations to those individuals that meet a risk category, which is a national risk category. We do offer within some of our clinics, so not the entire day, but parts of most days in our clinics in Bury, we offer microscopy, which is where we can look at swabs and STI diagnose and treat on the same day. We also provide access to contraception for those that have been identified at having an alcohol exposed pregnancy. So as our knowledge increases, we are aware that alcohol sort of pre or just post conception can be very sort of damaging to the baby as it grows. So those that have addictions and struggle with alcohol, it's important that we have strong links with those services that support them so we can get them on some method of contraception. All our departments and clinics and outreach team have experienced staffs that are highly trained in recognising patient vulnerabilities and safeguarding concerns, and that empowers us to signpost and refer on to partnership agencies such as Early Break, Healthy Minds, Social Services and Achieve. All of the services that Alice and I have talked about today are available across Bury, Rochdale and Oldham, apart from education, which is currently not available in the Oldham area. And a question that we get asked quite a lot is does it cost anything? You know, as a patient, do I have to pay for my pill today? Do I have to pay for the education? And just to sort of remind people that the service is not a cost occurring to the service user. That's it. Oh, and this is just our contact details. So our direct email address, the Bury Sexual Health number, the 0300 number, that's the main sort of dial-in to our switchboard. And then for the outreach team and for the young person service, so anybody sort of under the age of 19 can call the 017 number. The Sexual Health Hub website is a really good one to look at. That's got sort of lots of information, the links there for your online postal kits for screening and for condoms. And I think that's it. Ali, have you got anything else to add?
No, that's it. Thank you very much.
Thank you.
Hey, thank you, Alison and Penny, for that presentation. If you have any questions for Alison and Penny, make sure you pop them in the chat, or if you're viewing on Facebook, you can just put it in a comment below this video and we'll get to that in our Q&A section later. So now we're going to move on to Lauren's presentation from the LGBT Foundation.
Thank you. I'm just going to share my screen. Cool. Hello, so my name is Lauren and I use she, her pronouns. And I manage the sexual health service at LGBT Foundation, which is a charity. We are officially based in the city centre in Manchester, but we work across Greater Manchester within the sexual health programme and outside of Greater Manchester as well, nationally for some other services. So I won't be talking for too long today. I just want to give you an overview of our approach to sexual health and the services that we provide at LGBT Foundation. So firstly, all of our work is available for people who are aged 18 and over who live in Greater Manchester. Now, it's really important that I've added in this statement at the bottom about that we don't know what part somebody has or what they're doing with their bodies unless they tell us. And what I mean by that is that when we say we work with LGBT people, there are lots of people who may be having sex with people of the same gender, who might not identify as LGBT. So we also work with any man who has sex with men, any woman who has sex with women. And we know that that is, you know, a relatively high proportion of people based on some research that we did a couple of years ago, which essentially showed that a lot of people who are identifying as heterosexual are not necessarily only having sex with partners of other genders. And the other important thing to say is that when we talk about sexual health, we mean the most broad definition of sexual health. So it's really important to us to talk about passion and pleasure and to focus on elements of sexual well-being other than just reducing risk and avoiding STIs, because of course they're really important, but actually sexual well-being includes things like body image and sexual confidence and communication with partners. So it's much more than just risk and medication. Really sorry if you can hear that. There's a helicopter right above my house right now. So on this slide, this is a range of workshops that we provide. So all of our workshops are available for free, and we can work with organisations and venues to provide them. And quite often we also just put them on as standalone events if individuals would like to come and attend. We look at a range of sexual health topics. We talk about them in a really interactive way, and people get a chance to ask questions, watch videos, really think about things in a way which might be different from the way we were taught sex education at school. If you're my age or older, it's quite likely that you didn't hear anything at all about LGBT sex and relationships at school. And so I think it's important that we offer this now for adults who may not have the information that they need. We also do this in a really fun way. So we do a lot of arts and crafts-based sessions. We run a lot of sessions which are based on art and creativity. And there's some pictures here as an example. A vulva, which was made at one of our ceramics workshops, and a screen printed t-shirt, and also just an image of a participant who was at one of our sex-themed open mic nights. Of course, at the moment, we're quite limited in terms of what we can do physically in groups, but we will definitely be going back to this at some point soon. And in the meantime, we are doing lots of online sessions. We also have lots of one-to-one services. So we do a range of testing options. Now, it's really useful today that the clinical sexual health service are here, because we fulfill quite different functions really as a community service, because we're not healthcare medical professionals. We're not able to make diagnoses. So we see people who are asymptomatic, and it is a screening service rather than a testing and diagnosis service. And what we will do if people come to us with symptoms is we'll help them to access the clinical services that they need to get treatment. We offer at the moment lots of remote options, so video calls where we'll talk to people about sexual health and ensure they're able to take their own samples at home. And we also offer some in-person testing, which of course was paused during the pandemic, but we will be returning to. And that takes place both in Manchester and in all of the 10 Greater Manchester localities. So we will be out in Bury at some point soon. And at those testing clinics, we offer rapid testing for HIV, and we also offer self-sampling kits, which then are sent into a clinic and tested for things like chlamydia, gonorrhea, syphilis, and hepatitis. as the other service was saying, we also provide lots of condoms, so we can deliver to services who want to distribute. We provide safer sex packs in lots of venues in Manchester City Centre, lots of bars. And we also offer, at this link at the top of this page, lgbt.foundation/condoms, a postal service where people can choose what types of condoms they get. So if you want to order any large or latex free, you can do that and we'll send them straight to your house if you're in Greater Manchester. We have lots of written information and resources. Some of the most popular ones at the top here are our sex guides, but we also have lots of information cards and leaflets which we can distribute. This PEP card is particularly important. Like the other service was talking about the importance of PEP as an emergency medication to prevent HIV after a potential exposure, and as well as a gum service that is also available at accident and emergencies, where staff may not be medically trained, they may not be sexual health specialists, and quite often you might need to, you might feel you need to have some information with you to back up the urgency of that request. And so these little business cards are really useful to pass to receptionists, and we can print and provide those to services if that's useful at all. Lots of online campaigns talking about HIV prevention, sexual health, communicating with partners. We try to be really inclusive in the way that we're communicating sexual health messages, so we include lots of different body types, lots of different abilities, ages, just to make sure that we move away from a really traditional model of all of the people in any kind of health promotion literature being relatively young white people who look like they're in heterosexual relationships, and just to make sure that when services display all of our literature, it acts as a sign to say the people working here are comfortable having these conversations with you, and hopefully allows people to open up a little bit more. And then, of course, we do lots of one-to-one work. So if people need support around consent or contraception, finding services, talking to partners, potentially things like coming out, we are always happy to talk to people. And although obviously we don't have an office at the moment, so we can't take incoming phone calls, if people email us or fill in the advice referral form on our website, we will call them back. We can set up video calls, however people feel comfortable to talk to us. And of course, we also have the LGBT Foundation's general helpline, which may not be staffed by sexual health specific staff, but definitely the staff you speak to will be able to signpost onto us and have a great understanding of LGBT issues and the rest of the services that LGBT Foundation have. So we have domestic abuse support, we have an independent sexual violence advisor, we have a domestic abuse team who can do casework, and we have LGBT competent therapists who can provide talking therapies for free. So if anybody has any questions or is wanting their family or friends or their patients potentially to have access to really competent LGBT support and advice, then always get in touch. We're always around. I think that's me. Thank you.
Okay, thank you, Lauren, for that presentation. Anne-Marie has the questions for the Q&A. Hopefully we got a few more during the presentations today.
Thank you, Catherine. We've not had more questions, but I think I've got about 8 that were sent prior to the live session. So if I read them out, the first question, where is emergency contraception available for free in Bury? I tried my local pharmacy, but I had to buy it. Don't know if any of the ladies here would be able to answer that. I'm sorry, I know some of them have been covered by their presentations, but might be useful just to go through the answers again.
Shall I take this one? So yes, it very much depends sort of on the chemist and on the pharmacist on duty about sort of whether you can get sort of free sort of emergency contraception. So my advice is you can get it from us, and if you phone up, we will generally try and see you as a priority to get you into clinics or assess you over the phone and arrange for you to pick up emergency contraception from our sort of main sort of clinics. As for chemists and pharmacists, I said it does depend. A chemist can do it one day because one pharmacist is on duty and then not the next day. So we generally advise, Boots is a good one, if we're allowed to mention sort of companies, is sort of ringing round before you sort of attend your chemist to make sure there is a pharmacist on duty that can provide it sort of free of charge.
That's great, thank you. It's useful, thanks. The next question, where can I find an LGBTQ plus friendly GP in Bury? Don't know if Lauren would be able to help us with.
So the best thing that I can advise for this one is to email PIP, so PIP at lgbt.foundation, and that will get you through to our Pride in Practice service. And they are essentially a quality assurance service. So they work with GPs, they go out to the practices, they check out whether they've got LGBT affirmative literature, whether their GPs have training on LGBT issues, lots of areas where LGBT people might typically struggle accessing healthcare. And they then award a bronze, silver or gold award to the practices which we feel are appropriately LGBT inclusive. So if you email Pride in Practice, let them know where you are, and they can then check their list of accredited practices and let you know who is nearby.
That's great, thank you. Thanks for that. That's really useful. The next question, where can I learn more about consent and setting boundaries with a new partner? Don't know if anybody would be able to help with that one.
Our service could help with that for definite. Depending on age, obviously, as long as they were up to the age of 19, we'd be able to offer that service within Bury. People can self-refer, they can ring the number and ask for to be added to the waiting list, or we do have one of our workers at the moment is sort of predominantly working the phone. So if anything comes through where it's just a conversation, or they didn't want the 6-week program, they just wanted to know more about consent, more about specific issues, or just like the where do I access emergency contraception, it would be that the admin worker would then put that person on the list for our young person's worker who's working the phones to then give that person a call and give them the advice and the support. If it was then sort of deemed that more sessions were needed, then we could make a full referral into the team and a worker would be allocated, because obviously, like we know, don't we, that some conversations lead into other conversations, and it becomes a much bigger sort of need for support. So yeah, that's something that our service could definitely offer.
That's brilliant, thank you. Lauren, did you want to come in?
Yeah, so of course Alison can only see people up to a certain age, so just in case anybody is over that age, LGBT Foundation work with people who are aged 18 plus, and we're more than happy to have those conversations on a one-to-one basis if that's what required. We can obviously signpost into our domestic abuse service as well if you feel that the reason you're not quite confident at the moment is because in the past your boundaries haven't been respected and you might need some support around that. But I also have, because this week is Sexual Health Week and the theme, of course, is consent, we have a news article which we posted last week, which was a really quick rundown of some basics around consent and talking to people, new sexual partners. So I am not on Facebook at the moment, but if I pop it in the Zoom chat, I wonder whether maybe Anne-Marie could put the link to that in the comments for us.
That's great, thank you. I will do. Thanks. Another question that we have is, do I have to disclose my sexuality when registering for a new GP?
So GPs now will ask. You absolutely don't have to tell anybody anything that you don't feel comfortable telling them. Personally, I think that it's really useful to tell your GP because it means that they can ask the right questions, they can make sure that your care is really appropriate. You won't end up in situations like I've heard before, like for example, a lesbian being consistently asked if she's possibly pregnant despite her only partner being a cisgender female. But if it's not something that you don't feel, if it's something that you don't feel comfortable doing, then that's your information and nobody else is entitled to have it.
Thank you. Another question that we have, do I need parental permission to get the STD test if I'm under 16?
No, is the short answer to that. But what we do is take a few precautions. So if you're under the age of 16, then you will need to answer some questions. So we ask some questions to make sure that you're safe, that you're not exposed to any risks, and that you understand sort of how to take an STI test and what the impact of the possible results could have. But you don't need your parental permission to have that, and as long as we don't identify any risks to you, then we can remain it can remain confidential that you've had the STI screen with you. And if you do pick up an infection, we can treat it as long as you understand why you're taking the medication, the implication of taking the medication, and there's no risks there. Then we don't have to share with sort of parents or carers that there's been a diagnosis either.
I think it's important just to add there to what Penny's saying is that any young person under 16 that or even over 16 that comes to our service, we do sort of encourage trying to be open with a supportive adult. So that might not necessarily be a parent, it could be somebody's older brother or sister, or an auntie or a cousin, but we always sort of encourage young people to try and talk to an adult about the things that are going on for them. We never want our service to appear like a cloak and dagger service. We're keeping secrets from people or anything like that. It's really important that we sort of try and foster good relationships and an open discussion about sexual health, relationships, and showing your parents and your carers that you are taking good care of yourself and preventing any sexual health infections or an unplanned pregnancy.
Thank you for that. That's great. The next question that we've been sent, where can I get quality age appropriate sexual health information for my child? I don't know if anybody would be able to help. I did find some websites myself. One of them was Stop It Now, and another one was NSPCC learning website as well. But I don't know if anybody else is aware.
Yeah, it depends on the age of the child. Obviously, sort of sex education is sort of given in schools, from sort of junior school. They sort of talk about bodies and what's appropriate and sort of touching and sort of things like that. So that question very much depends on sort of what age the child is and where they're sort of signposted to. But sort of they can, if they want to sort of phone our service, the young person's line, we can advise on sort of resources or, sort of help the parent if they're having difficulties around certain issues. We can sort of have those conversations with the sort of young person. But there are some good resources sort of online, but it's very difficult without knowing the age of the child that we're talking about, where to direct them to. The sites that you've mentioned are good sites to start.
We also, sorry, Lauren.
That's all right. Go on.
We also sort of can, if it's a younger somebody, say under 12, who's wanting to learn about puberty, or we're even getting everybody seems to be coming through younger now. So sometimes we have good links with the school health practitioners as well that can do those, you know, conversations with younger people as well. So I think as a main point, the parent could come through to us and then we could signpost out depending on the age of the child.
One thing that I quite like is that the BBC have a bank of teaching resources which are organised by primary and secondary age, and some of those are quite good. There's lots of video content that's really useful, and if it's specifically around LGBT issues, the Proud Trust is based in Manchester. They work specifically with young people who are LGBT. And there's also Mermaid, who specifically work with young trans people.
There's also some really good Usborne books for younger people as well. There's a girls, they're quite, you know, girls and boys, but for sort of the just diagrams, or for people who have additional needs and things like that, where looking at pictures is better for explaining things about anatomy and things like that. Those are quite good books as well to use. Yeah.
That's great. Thank you. Thanks for this. The next question we've been sent, where are free condoms available in Bury?
Do you want me to answer, Pen? So young people can access condoms through our service. They can drop in, or they can drop in if it's just to pick up condoms from our reception desk. A lot of places now are being reintroduced to the C card scheme as well. So hopefully soon there'll be a list of outlets that are going to be providing condoms, lube, and safe advice for people as well.
Yeah, it's a lot of it's sort of with COVID and things, sort of a lot of outlets stopped. A lot of our schools and colleges sort of obviously were closed. So in the last sort of couple of months, we're really building up the sort of service again. And, you know, sort of, so to give you sort of a list, but, you know, sort of schools, the colleges, and sort of sexual health at the moment are our key outlets in Bury.
Thank you. That's great. The last question that we've been sent, what support groups are available for LGBT people in Bury?
So there's lots of groups which are available online at the moment, but right now not many in person, unfortunately, although they will be coming back. So if you have a look at LGBT, well, hang on, I'll get the link. I'm not going to try and remember it. But essentially on our website, we've got a list of all of our support groups which are available, and some of those are quite specific. They might be, for example, based on a certain topic, or they might be for a certain group of people, but lots of them are just general LGBT groups, which is great. If you ever, just in case anyone's kind of listening to this who's not in Bury, if you ever feel like you really can't find anywhere, give us a call on our helpline, and our helpline staff have got big lists of groups that we know of and who we've worked with that can be really useful. I'm just getting that link. So if you go to lgbt.foundation/events, or if you click on the How Can We Help You button at the top, there's a groups part on the website that hopefully will be useful.
Thank you, that's great. I think Bury Directory also might have some information as well.
Were those all the questions that we had?
Yes, we've not been sent any further questions so far.
Okay, so I'll probably just wrap up the session now if no one has any further questions. I'd like to say thank you to our guest speakers, Alison, Penny and Lauren, for joining us today. And if you have any further questions for our guest speakers, you can obviously contact them directly, or you can contact us, Healthwatch Bury, and we can signpost you to the most appropriate person there. So thank you all for joining us today. Goodbye.
Bye.
Bye.
Thank you.
Thanks.
Bye.